There's a sharp rise in COVID cases in China. Union Health Minister Mansukh Mandavia will be chairing a review meeting tomorrow. India is stepping up its genome sequencing of COVID-positive samples amidst the growing outbreaks in China, Japan and South Korea. The health minister has asked states to send as many samples as possible to concerned labs. This is important because this was being done regularly when India had high COVID cases. This is how, through this process of genome sequencing, that the Indian government identifies if there is an outbreak of new variants on the horizon. That effort had slacked during the last few months as India recorded very low COVID rates, but those will now be stepped up. Listen in.
The INSACOG data shows that almost every subvariant of Omicron, which is found anywhere else in the world, is also found in India. So there are not many subvariants which are not circulating here. Almost everything is circulating. And in this scenario, it is an important thing that we keep a close vigil on Chinese situation. And but I would say that there is nothing to be panicked about.
Meanwhile, what's happening in China? Now, here's the tricky part. There are no official statements or numbers of what's happening in China, but visuals like these have been put online, and these videos and images have come to light where ICUs are packed with COVID patients, some being treated on the floor because there is a shortage of beds. Videos, and remember, all of these are posted online, so there's no way to know the authenticity of these. These are social media reports right now. So these videos are also showing dead bodies scattered on gurneys at a hospital. It's a dismal sight coming in. There are reports that police and administration is stopping people from going towards morgues to really assess what's going on. Now, we can expect that a true picture emerging from China will be difficult, but one of the reasons this has come to light is a post by Dr. Eric Fiegelding, who's a top epidemiologist. He is actually joining me on the show, and he's the one who first put out these tweets yesterday, which has led to a lot of conversation of what's happening in China. So, Dr. Eric, thank you so much for speaking with us here on Mirror Now. Your tweet on the 19th of December cites epidemiologists estimating more than 60% of the Chinese population, and that's 10% of the global population, will be infected. The deaths will be in the millions. I want to understand, on what have you based this claim? Who are these epidemiologists?
They're cited in my thread. There's a research group in the Bloomberg article and there's many other epidemiologists where 60%, look, 60% is not that high. We've seen 60% easily during the initial Omicron wave in many other countries. And that's even with previous infections. Most of China is the virgin uninfected. So 60% is not that high at all. Like, we've seen antibody studies in which in one winter, in England, basically 90% of people had infection residual antibodies. So we know that this is very likely. We've seen when the virus burns through the entire population, 60% of the population is not that high at all, considering that how densely populated China is compared to many other countries.
Dr. Eric, the current outbreak is supposed to be from the Omicron variant, which typically spreads very, very fast, but has fewer casualties. So I want to understand that death figure that everyone's talking about. Will that be the case here too?
Well, as I mentioned earlier, even if it's Omicron is milder, and again, it's not that much milder, it's just that it looks milder because previously more people were infected. The issue is, if you have two viruses, one is more severe and less contagious, and then another one's more contagious and less severe. Omicron, in many ways, is the more contagious, and some argue less severe, although it's more severe in children. And that's also been proven by studies, that a more contagious virus, even if it is less severe, will ultimately kill more people. So that relying on Omicron's lower severity is not a solution out of this pandemic. In many ways, we've seen Omicron come back with many subvariants again and again. And again, the number one driver of sending more people to hospitals and dying is contagiousness. Contagiousness, if you balloon the denominator of people infected, you will ultimately send more people to hospital. And that's inherently the problem of all these subvariants of Omicron, these new highly immunity evasive subvariants.
I want to understand, is this outbreak also exposing the poor efficacy of the Chinese vaccine Sinopharm? Because they were the first off the block with the vaccine. And right now, not enough of the population and the elderly population has been vaccinated. Is this whole episode also exposing that this vaccine isn't that great?
Yeah, Sinopharm and Sinovac vaccines have traditionally always been the weakest vaccines in terms of antibody response. We've seen it time and time again across studies. So we know that the Chinese inactivated vaccines were not enough. And China should have imported other vaccines that have more higher efficacy, or at least developed updated, adapted to the variant vaccines that many other, like Pfizer and Moderna, have both updated their vaccines to the new BA.5 Omicron. But China's vaccine still mostly using the old generation Wuhan 1.0. So I think that's both of those issues have been very serious, in which China has been behind the ball in not using the latest vaccine spikes, as well as in using vaccines that have lower efficacy, and also not importing other vaccines whenever they could have, to save more lives. But at the same time, China is developing newer generations. China approved like half a dozen new vaccines recently. They're not all well tested, but hopefully one of them will have, especially the mucosal inhaled vaccine will be a game changer. But that's not used enough, and it's not mass produced enough compared to some of their old vaccines. So I think China has dropped the ball on research, on R&D, and on rollout of newer vaccines.
Is there any likelihood of understanding what really is happening from China in terms of an actual estimate of infections and deaths? Because that's the big concern. We don't have any official sources of videos, of information, of what really is going on.
Not at the current time. The issue is that China is not testing as much. Previously, China used to test so much if you move between cities, China would test everyone who traveled between cities. That's no longer done anymore. Random street testing is no longer done anymore. So the accurate count, but that said, does the West have accurate count? Does India have accurate count? Many deaths in India during the Delta variant wave weren't even counted properly. We had to rely on estimates and modeling. WHO had to rely on excess mortality modeling. Mm-hmm. So, whether we get the accurate count is hard to say, but we know that infecting 60% of population, that is very easily doable with Omicron, because we've seen it time and time again that with such a high infectious population, you can have a high number of people infected by this, highly infectious virus. And there's people, workers are not going to work partly because of this. I had interviews with China and that were canceled because most of their staff was too sick to work because of COVID. Altogether, it shows China does have runaway infection, and that's just in the major cities. China has also dozens of cities of more than 10 million people. So I'm very worried for China's future.
The concern on a global level seems to be that whenever there is this large an outbreak, we will see a new mutation. That's something that the US State Department also spoke about today. Is that a valid concern? As an epidemiologist, do you think that that's a real concern? And would you recommend that flights from China at this point be monitored?
Yeah, right now there's a lot of COVID worldwide. Obviously, I think there should be testing. We shouldn't block travel because in many ways, I think the burn through is going to be unique to China right now because they haven't had a good protection or previous infections. But I think it is still a risk to the world. I think we should always test travelers. That's my opinion. Now, quarantine, I think there should be at least some home quarantine at any destination you go to, if possible. But I don't think we should block international travel at this stage. But we should at least do testing and quarantine whenever possible.
You know, the catch-22, Dr. Eric, seems to be between zero COVID and easing of restrictions. Before this, China was so strict that people were protesting in November. So should they, in your view, go back to strict lockdowns now? It seems a choice between the devil and the deep sea.
I don't think we should go to strict lockdowns. I want to emphasize zero COVID does not equal lockdowns. You can have zero COVID without lockdowns at all. Not just mass testing, but also N95 masks, ventilation, air disinfection, and of course, updated vaccine boosters. And if you can, and I think the most important thing here is actually ventilation, air disinfection, in addition to vaccines, because this is an airborne virus. And if you can stop, if you have very good ventilation systems or air disinfection, you can stop most airborne viruses. In addition to wearing masks in very crowded situations, I think together with these three pillars plus testing, you could easily stop COVID without resorting to lockdowns. We don't need lockdowns, but if we don't do lockdowns, we need to do all the other things to avoid the lockdowns, which we should.
You know, this is exactly what I think India was going through earlier this year. January 2021, this is what China is looking at now, but at least there was clarity, we were open, transparent, and we had options for vaccines. What China does is one of the largest economies in the world, impacts everyone. Thank you so much, Dr. Eric Ding, for speaking with us today.